with you all. And then I'm going to turn it over to Oralia to share some of the experiences that her team had doing the survey and some of the stories that she heard from workers in the field. So let me share our PowerPoint. And let me also, I'm going to, or maybe somebody can, I'll post really quickly in the chat the website, there we go, the website for the study. So like we mentioned at the top, the project we're sharing today is the COVID-19 Farmworker Study. The website is here and in the chat. This project came together in just as the shelter-in-place order was coming down in the middle of March in California. We put out an inquiry to some of our partners in the research community and in the farm worker serving community. Okay, we know COVID is here, it's in California. Who is tracking how it's going to impact or is already impacting farm workers? And we heard from a few folks that they were already collecting testimonials from within their networks of farm workers, but it didn't seem like any state agency or research group was poised to collect information about COVID-19 in farm worker communities. So very quickly, a large group of researchers, of policy advocates, of community-based farm worker serving organizations came together to design a study that would make sure that the voice of farm workers came into the public conversations about how we were addressing COVID-19. And so there are many partners in this effort. That's what I'm trying to say here. They're listed on the website. There's a deep bench of researchers and other folks that have longtime farm worker advocacy roles and involvement. There are 6 organizations. Oops, sorry, there we go. There are 6 organizations that assisted in the data collection itself. And those were, our partner organizations were the Centro Binacional, Oralia's organization, in Imperial County, Comité Cívico del Valle. Líderes Campesinas did surveys across the state, as you can see on the map there. A small organization in Porterville called Alianza Ecologista did some Central Valley surveying. And also in the Central Valley, we had the Central California Environmental Justice Network. And again, in the South, the Farm Worker Care Coalition helped us to talk to workers in San Diego County. So the study is designed in 2 parts. And the first part, the first phase, we completed at the end of July, right? This group of folks mobilized in March. We, community partners, were at the table with researchers designing the study. And by May, we had the survey out in the field. So from May to July, these partners were hard at work, working their networks, calling down their list of contacts to talk to 915 workers across the state. And that the first phase of the study finished in July. The second phase is currently in the field now. We always knew that we needed a way to get rapid response information about how COVID-19 was immediately impacting the health of farm workers. We knew we wanted to talk to them about workplace conditions and changes they were seeing or not seeing. We knew that we wanted to talk to them about their household and their ability to quarantine at home, transportation to and from work, healthcare access, and some of the sort of short-term economic impacts that COVID-19 was having. So with the survey, the phase 1 survey covered all of those topics. But we knew that there was also going to be some longer-term impacts of the virus and of the reaction, the protective reaction to the virus, right? And so we're currently doing a second phase follow-up set of interviews, also across California, that are talking to people in more in-depth ways about economic and social and mental health impacts of the virus. So we're currently talking to about 100 to 125 workers with longer hour-and-a-half interviews to get more nuanced information about the social impacts of the virus. But and that data we expect to be collected soon, and we'll have that information by the end of the year to share. But our survey is what we're reporting on today, since that other phase is still happening. And I'll just make two more quick points about how we did the survey in California. And the study design distributed the surveys across the state based on agricultural labor demand, right? So we looked at the typical employment in different regions of the state in the summer months, and we distributed surveys that way. So you can see that a lot of the surveys were conducted in the Central Valley. The bulk of them, more than half of them, happened in the Central Valley, with then a large chunk of them also happening here on the Central Coast, and distributed from the North Coast down to the South. So that was kind of the rationale for where we did the surveying and with who. And then we also knew it was important to talk to workers who were employed in a variety of different ways. So we talked to workers who were hired directly by farmers, growers themselves. We talked to a number of workers that were employed by farm labor contractors, and also to folks in packing houses. So this data reflects worker experience across those three kinds of employment types and across a whole wide variety of different crops and jobs within those industries. So people that are picking and packing, but also doing irrigation and other tasks like that. And I should say, I didn't mention this at the top, but what we're talking about today, Oralia and I, is the California data. But this actually is a tri-state effort. So it's partners and colleagues in Oregon and Washington as well are running this survey right now. Oregon just completed their survey and shared some of their results, but we're hoping that in the next few months, we'll be able to say something about the region overall. We know that farm workers move from California north and back down again, and we're hoping that we can say things about the Pacific region, and that could have potentially federal level impacts on how we're supporting workers right now. Okay, so we knew when we came together in March that we had a major challenge here to doing a study. And I should say that CIRS is in a facilitation role here, right? We had a lot of people come together to design this thing. CIRS is sort of doing choreography. I'm kind of doing choreography and putting this together. So the group of 40 of us looked at this moment, looked at this intense moment of fear in terms of the pandemic and social distancing. And we knew that the way that we had, that we've typically interviewed farm workers by going to fields and doing face-to-face interviews wasn't going to be possible in that moment. So we designed a telephone survey. And as soon as we knew that we wanted to talk to people over the phone, it was obvious that we were going to have to really have community-based organizations at the heart of this study, and that the only way to talk to workers was going to be through trusted networks that our community-based orgs have spent years or even decades in some places building, that trusting relationship with workers themselves. So we made sure that the study design leaned on that strength of our team, and that we partnered with frontline organizations to do a snowball sample. So like calling folks and calling their contacts through these network lists. And we coupled them with experienced researchers who helped to design a survey that could really collect the most quality quantitative information in this quick way, but that also put a lot of comment boxes throughout the survey so that we could be collecting qualitative information that would help us make sure that the quantitative information was actually what folks were meaning to report, that helped us to kind of have a more nuanced understanding of some of the numerical information that was coming back to us. And then importantly, because we wanted all of this to happen at light speed in terms of a research project, we used a web-based survey system so that as our interviewers were collecting the surveys, our data team could be behind the scenes doing all of the research cleaning and coding and all of the things to make sure that by the time the survey was complete at the end of July, we'd be able to share something publicly. And that the last slide I showed you, we finished the survey on July 21st. And by July 28th, we were hosting a press conference and briefing the governor's office and talking to the Latino caucus of the state legislature. So because we kind of had this partnership and really good communication all along, we, which wasn't easy, by the way, I'm not trying to paint a rosy picture here, but because we were in dense partnership and collaboration all along, we were able to move at the speed of COVID, really, in this fast-paced environment. And so because we used that method, we were able to talk to 915 workers very quickly, thanks to our, the valiant efforts of our community-based orgs. But it's not a random survey. So we knew that, there could be potentially some pushback from critics of the survey, from industry, from folks like that, saying, hey, there's 800,000 farm workers in California. How can you say anything based on the fact that you only talked to 900 of them, right? But we tried to, with our experienced research knowledge, the experts on our team that have done this for 40 years, Rick Mines and Don Villarejo and folks like that some of you might have worked with over the years. We tried to kind of make it bulletproof by having some demographic targets about who we were talking to. And in the end, because we're able to compare the data with some random some data points that are random representative samples, like the National Ag Workers Survey or the NAWS, we know that the data we have does actually match up. It reflects what we know about the farm worker population in California. So on age and gender and the kind of crop that people are working in, the number of years that they've spent in the US, the age that they arrived to California from, typically from Mexico, although there were some folks from Central America, other countries in Central America. All of those roughly reflect what we know about the farm worker population. So, so we're glad to have met those goals and be able to sort of point to that in terms of how sound this data is and what we can say about how it reflects the farm worker population. And thanks to partners like Oralia, who, as she mentioned, did a large chunk of the surveys. They did 36% of the surveys here. We have a big sample population of Indigenous farm workers who, as Oralia will talk about in a minute, are some of the most vulnerable, we know are some of the most vulnerable farm workers in the state. So we've talked to hundreds of Indigenous farm workers, and we're glad to be able to say things about them. So I'm going to try and keep this pretty brief, running through some of the findings. So all of that was sort of how we did the project and how we pulled off this difficult thing in this moment with this big collective team. Now I'm going to switch to talking about some of what we heard from workers. And I'll just say that on the website that I linked to, you can get this information in a one-page summary form. You can read a fuller data brief. You can read about the specific methods and demographics. So that website has all of our information in English and in Spanish. It's there for you, so you don't have to scramble and try and follow all these slides. But we did find that slightly more than half of the farm workers that we talked to were unable to or had difficulties in accessing healthcare. Part of that, of course, is lack of insurance or lack of sick leave that were significant barriers. But also importantly, a quarter of respondents mentioned fear as an impediment to seeking care. And of course, that's not fear of contracting the virus. That's not fear of accessing clinic care because of COVID. That's fear, as you can see, mostly it's distrust of the healthcare system itself, or fear of the government or deportation, which is a pretty significant finding, I think. and leads to, on the left-hand side of these slides, are recommendations that we have that are drawn from the data. So expanding healthcare access and coverage regardless of documentation status is certainly a piece of the puzzle to supporting farm workers in this moment. This is something that Oralia will talk about in more depth in just a few minutes, but 16% of our folks that we talked to completed the survey in a native indigenous language, so Zapoteco or Triqui, Mixteco, but we know that a larger group of them, 36%, as I mentioned, were completed by CBDIO. And so while 16% did the survey in an indigenous language, we know that a larger chunk of them are identify with an indigenous identity. And we know that, COVID information, like all information about where farm workers might seek support, that information, if it's in English and Spanish, that's about the limit of the ways that agencies, local governments, other folks are communicating. They'll do an English version and a Spanish version, perhaps, but we know that there are many, many other languages spoken in California and in California farm fields, and that that those folks deserve to be served using their own native languages, and that language justice and thinking about communication of information in language appropriate, culturally appropriate ways is also a really important way to be giving farm workers justice in this moment of COVID. So next data point here, half of the survey respondents reported decreased farm work time and income losses, which obviously make it much more difficult to meet basic needs. We know that the average farm worker in California, because of the seasonal nature of work, right, it's not full-time year-round, make average income is about $18,000 a year. And so then obviously, as the food service industry changed, as the wholesale industry experienced the dramatic loss in demand that it did in the spring, that obviously impacted the amount of work available on California farms, and also the ways that other industries collapse. So as the retail and the hospitality industries collapsed in the spring, workers, some workers returned from those jobs that they had lost to the farm field. So there was both a dramatic decrease in demand for product, and we read and heard about farmers fallowing fields and letting crops go as the market crashed, but then also a flood of workers from other industries who came into the field. And that was, Oralia can share more stories and experiences there, but half of what it meant was that half of the folks talking to us lost income, and that makes a very precarious economic situation within a family even worse. So thinking about expanding the income and safety net support for farm workers at this moment is obviously also a high priority. So farm workers also told us, and this was in the summer months, so the situation may be changing now, may have changed, but they told us that they weren't really getting the proper protective equipment at work, personal protective equipment. So only 54% of work sites provided face coverings, and hygiene practices and other kinds of changes were slow to come to farm fields and weren't being reported in the ways that we would have hoped they would be to protect essential farm workers in the fields. So this chart here actually shows some of the recommendations that farm workers had about how they could make their workplaces safer. And we definitely know that they themselves, of course, know best about the points of infection, the possible problem places within work where they're not feeling safe. And so in addition to recommending that we ease the barriers for farm workers to report COVID-19 related complaints, We also are recommending that employers and the industry really involve their workers in designing safety plans and in coming up with ideas about how they can change systems, even at a very granular level, to prevent COVID. And one other thing I want to point out about this finding is that you can see the dark blue bars there add up to the majority of recommendations. I think it's roughly 60% of recommendations were targeted at employers that people were telling us. But 30% of workers also said employee side cooperation with COVID prevention practices is also important. So farm workers were telling us that they understand that this is sort of everybody in it together. Employers have a responsibility here, but employees do as well. And I think there's an opportunity in there to have employer-employee conversations and involvement in creating safety plans about how COVID could be, how workplaces could be made more safe in this moment. So another point here was that 90% of the people that we talked to reported taking precautions to protect. It wasn't just a matter of hygiene, sort of washing hands or changing clothes or showering, distancing themselves as they come home from work, but it was also folks telling us that they were physically distancing and following the community isolation sort of guidelines that were really recommended to stop the spread of COVID. And this point also has important political implications, I think, because there was a narrative, and there still is a narrative, I think, that some of the Latino communities, farm worker communities, were sort of flaunting COVID guidelines, or not doing everything they could to protect themselves after work. And we just didn't hear that within our survey. We found that people were taking this seriously, that they were afraid of COVID, and that the spread of COVID within farm worker communities isn't because workers aren't doing the proper things to distance themselves. So I'm going to wrap it here and leave time for Oralia to really share some of the stories of workers and her experiences with the project here. But I'll just quickly say, the idea behind this project was to turn data into action. And so there's a lot of recommendations that come from these data points, and some of them are listed here. We know that it's really important that employers as well as county health departments are reporting and releasing publicly information about infections by occupation and industry. This isn't something that has happened in any coordinated way to date over the course of the pandemic. Monterey County here on the Central Coast was actually one of the counties that was doing a pretty good job of reporting farm infections based on occupation. And in the summer months, by the end of July, we knew from that data that if you were an agricultural worker in Monterey County, you are 3 times as likely as a worker in any other industry to be infected by COVID-19. Now, that isn't because it's somehow worse to be a farm worker in Monterey County than it is in other counties across the state. That's simply because Monterey County was doing its job in tracking and reporting the places where COVID was surging. So there's actually a new law in the state of California that is mandating this reporting by industry on the employer side and county health departments. And we're glad to see that. That's really important that we have good access to data so we can understand who this is affecting and when, and how to respond to it. The second major recommendation is about mobilizing community partnerships. So I spoke to this a little bit already, but including community-based organizations in emergency disaster plans. And current needs especially, as wildfire smoke now compounds risk and vulnerability to COVID, it has been, around N95 mask distribution and beginning to balance physical health priorities and the importance of preventing the spread of COVID-19 with some other serious health risks that are, now being experienced by farm worker communities, including, mental health, fatigue, exhaustion, stress, that are real, that come from the long, prolonged pandemic itself and the response and reaction to COVID-19. So thinking about an actual balance in these kinds of things is really important, and that community-based organizations have a lot of data and information and stories to share on that. And then I'll just skip down to the last one because I want to leave a lot of time for Oralia and then questions and dialogue with you all. But it's really critical that we be thinking about how to equitably address health crises like these and pull back to understand what some people call the social determinants of health, other people call, structural injustices, structural racism that have set up systems of housing, of healthcare, of access to food, of childcare that are fundamentally imbalanced. And I think that we clearly can't address a pandemic like COVID-19 without thinking about some of these largest issues that create pockets of very vulnerable communities throughout our state. And I think we have to really be using this opportunity, which has underscored and highlighted the intense vulnerability of the people that we depend on the most to feed us. We really have to be using this as a moment to think about what is the structural change that we need to right those wrongs, and to think big about some of these the fundamental ways that we've organized life in California that makes a group of people very vulnerable in this kind of a situation. So I'm hoping that we can all kind of use this nuanced information about what workers are telling us now to make the biggest and most long-standing change that we'll need, so that we aren't in a situation where we have a big group of vulnerable people in the future. So I'll stop there and pass it to Oralia. I hope I didn't talk too long. I hope there's lots of time for questions and Oralia.
Gracias, Ildi. Como había mencionado,
thank you, Ildi. Like she mentioned earlier, we are working with the indigenous communities as part of this study. What we found is that there is a lot of information from the Department of Health by the different levels of government in terms of what are the nuances of COVID. However, all of this is just in English and in Spanish. So it's been very difficult for indigenous communities to have access to this information. And also in workplaces, there hasn't been any presentation of protection in the places of work for people who speak indigenous languages. So this is something that we are promoting, that this happens as well. And that indigenous communities are considered, and that they have language rights over languages that we have as indigenous people. One of the things that was shared by the people who we surveyed was this fear to receive protection, medical support, healthcare. Now, what we're recommending is that if there are that people have symptoms that they go out and seek the care they need. Because all of the story that has happened in terms of the political situation in the state, in the counties, in the country, the community doesn't trust that uh, these services are free. So they've asked, will we be cared for? Will our children need to pay for this medical service and these services that we receive? So access to healthcare has been one of the biggest challenges. These have been some of the things that we have found. One of the things that we have seen is how is it that this pandemic have impacted families' income and economic status? Because there's some people who were working in the fields had to stop working in the fields to now care for their children as the schools were closed. They needed a they needed to see for them. Another thing is that an impact to this has been that in the places where many work sites have closed, like restaurants, people who were selling in flea markets, or people who were working in hotels, they lost their work, so they had to return or look to work in fields. What this happened is that it reduced the season of work. Here in the Central Valley, the season reduced because there was a lot more workers in the field. And these are stories that we were hearing from the people by doing these surveys. These are the things they were telling us, that there was a lot more workers now. If there are people in the oranges, that they've already switched. The season is generally a lot longer, but however, it was shortened now. So these are some of the challenges that we have found in terms of the economy, in terms of healthcare system, in terms of access to language. So the things as an organization, what we've been doing con- to confront these, what we've done is, first of all, is we've asked the people in our community, our indigenous community, what is the best form to receive information and what type of information would be needed. Saw that many of the people in our community don't have access to the digital or technology equipment to be able to connect to programs like Facebook or other social media. And so we started creating audios and videos that we can also share with our communities so that they have information over what is COVID and how to protect themselves. One of the things that we are doing in this moment is, and what we workers shared with us, is that in the places of work, not all employers are taking uh, these protocols or implementing protocols to reduce the spread of COVID-19, and they're not using um, personal protective equipment nor giving it to workers. And so what we've been doing is we've been distributing this personal protective equipment to the workers and also giving them information as well over the changes in the laws that are happening. Also for us as an organization, this has been a challenge because we have to be updated and know all the changes in the law that are shifting quickly now, specific to the the rights that people have now in the fields, so that people in our community have this information and all the resources that they need.
Aunque sabemos que
Although
esto
we
no
know that
es
this is
suficiente
not
o no es
enough.
suficiente darles un
This is not
cubrebocas
enough to
y
give
que no
them
es suficiente
a face covering.
darles la información.
It's not
Ahora,
sufficient just
para
to have
nosotros es
information or to give
importante
that to
ver
them,
de
but
que
most of all, what's important for
en
us is
este momento
that in this moment,
están llamando trabajadores esenciales a
people
los
are being called
trabajadores
essential workers
que trabajan en la agricultura,
that work in
pero
agriculture.
los trabajadores
However,
siempre han sido
the
los
workers
trabajadores de la
have in the
agricultura
fields have
siempre han sido
always been
esenciales, no
essential,
solamente en este momento.
not just in this moment.
Y esta pandemia lo que
This
hace es que
pandemic, what it
pone
does,
al frente de nosotros, pone
it
al descubierto
puts
la
in front of us,
inequidad que existe
it makes
en
it
cuanto a los
visible
derechos
this
lingüísticos, derechos de salud,
inequity in
derecho a salario,
linguistics and
todos los
salaries,
derechos humanos a los que
all
tenemos
of these, all the human rights
debemos
that
de tener
we
acceso.
should have
Y
access to.
este estudio y la
So
plática
this study
con
and this
nuestras
is
comunidades
dialogue with our communities
es importante porque
is important
creemos
because we
que
believe
esto
that
nos ayuda o
this will
debemos de
help
impulsar nuevas políticas que
to
beneficien a nuestras
impulse
comunidades
new
y que los
laws
trabajadores del campo
or
tengan los derechos plenos como
protocols
seres humanos que
where
necesitan y para esto es
the
importante
workers
que
in the fields
todos
actually have
podamos
human
trabajar,
rights
la
so that
comunidad, las organizaciones
all of us can work,
comunitarias, los
the
investigadores,
organizations, the community organizations, the investigators,
poder tener
the
estos derechos
workers, so that all of us
como
have
seres humanos,
the
¿no?
rights
Entonces,
that
ahorita estamos viviendo un
we
momento
have
muy
as human
crítico,
rights.
pero
We're
también es un
living a
momento
very critical moment, but it's also
porque podemos
an opportunity. It's a
trabajar
moment of opportunity where we can work together to assure the well-being of farm workers and to assure they have their rights as human rights.
estamos hablando
Because we're speaking about how
está afectando la
is
economía de los hogares, de los trabajadores del
how is
campo.
this
Si tuvieran
impacting
salarios
the economy
dignos,
of
si
the
tuvieran
family. However, if they had
las
dignified
seguridades
salaries and everything
no
that they
estarían
needed, they
en
would
esta
not be in this situation,
de, de economía, también
in
los
this
cambios
economic
que hemos
circumstances,
notado,
in these changes
por
of
ejemplo,
food.
ahorita con los trabajadores del campo, es de que sí
Things
hay
we've
lugares en
spoken
donde
to,
están ofreciendo comida,
there's
están
farm workers who are
ofreciendo
talking to us
pero la
about
comida
having
no
access to
es
food in the food banks.
la apropiada
However, these
que
aren't
ellos
foods
están
that
acostumbrados
are
a comer.
appropriate for us or things that they're accustomed to eating. Sure, they're giving us food, but it's food that is canned. It's not the food we eat. So it's also this switch in diet in this moment. It's important that we see and look that we are mm, we are living in this critical moment, but it's also a moment of opportunity where we can change to 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 do to advocate to create a whole systems change to see that we don't need these laws that have impacted our communities.
Gracias, Oralia. Creo que este es un buen punto para
So this is a good
para
moment for
preguntas.
us to
Yeah,
receive
I think we're ready
questions.
to think about questions now, if people have them. I don't know, Margaret, do you want to facilitate this point? I see Jorge has a question. Do you want me to facilitate this part, or should I turn it back to you?
I've been monitoring a few questions that have been coming into the chat, so maybe we can start at the top and then we'll get to Jorge once we get to the questions that folks have already
Okay.
asked. That works. So the first question someone had was about the interaction between recent wildfires and the COVID risks. And we were asking if you all were able to survey farm workers on how they felt during this period. And if not, maybe you could speak to what you anticipate the impacts of the fires have been on farm workers. And I know this isn't the first year that we've had a really extreme fire season that has impacted folks, but yeah, just wanted to see what your thoughts were on those compounding factors.
So I'll just say that, our second phase of our survey is happening now, these in-depth interviews with folks. So I imagine we'll have some things to say about the way that wildfire smoke and risk just made these problems even worse, right? We know that the way to protect yourself from wildfire smoke is not possible if you're a frontline farm worker. We've all seen the pictures of people out under the smoke. And we know that a lot of the COVID protections contraindicate against wildfire protections. Be outside to prevent COVID, be inside to protect yourself from bad air, etc. So it's a major problem. Our survey didn't capture that because it was before. But maybe Oralia, do you have stories that you're hearing right now about how smoke is making things even worse?
Lo que se ha visto ahorita, ¿no? En que a pesar de que está.
So what we see now and in the pandemic, workers are still in the fields. The fires, workers are still in the fields. So this makes them extremely vulnerable to contract these ailments related to the respiratory system. But also with this pandemic, it's very confusing in terms of what the symptoms that farm workers are feeling in the field. And air quality is also impacting the farm workers who are already have and experience chronic illnesses, but they don't have a different option or the option of staying at home, particularly.
Al desempleo o que no.
And we're speaking about also farm workers who can't access unemployment or support from the federal government, just like the stimulus package or support. So they don't have the option really is to continue to work, although we know that it's an environment of danger, and they continue to work because there are no options and or privileges to stay at home.
All right. Thank you both for speaking to that question. Maybe we can move to Jorge's question next.
I think you might have to we think it's a comment, in agreement with Oralia. I am a community organizer with the project, the Mixteco project. Here in the area of Ventura, there is 85% of the farm workers are indigenous, Zapotecos, Mixtecos, and Purépechas in Santa Paula, and in the lemon industry in avocado, here in Oxnard, blueberry, strawberry, blackberry. It's a situation that's very complicated because with the fires, with the rain, with the sun, with the heat, with the pandemic, there is no law that obligates or makes the companies or corporations to give additional protections to their workers. In the calls that we received and we've done with the farm workers in the region, additionally, Líderes Campesinas were giving PPE materials, equipment in fields, in agricultural fields. However, the companies are not permitting that other people permit to come into these fields, to these agro industries. So when the organization gives it to the supervisor, they don't give them to all the workers. Here in Oxnard, for example, if there are multiple areas of work, they're not provided. I have it documented that Líderes Campesina went to one of the corporations and they gave it to the supervisor. However, the supervisor only left 1 or 2 boxes there. It's very complicated. There is no water for washing hands. There is no paper towels. There is no disinfecting material. to 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 protect yourself against the pandemic. Additionally, I asked one of the workers, the farm workers, when all this started in April, if in the strawberry they would the what is the distance between each other when they are picking strawberries. When you leave your box of strawberry, they say you must be separated. However, inside, when you're actually picking the strawberry, there are rows and rows of strawberry. I worked in the strawberry fields. When you look off to the side, your heads are almost hitting each other because they're so close to each other in these rows. So the protocol is to leave one of these rows without a person working it so that there is additional distance between the people picking. This is a circumstance that are normal. And I asked some of these the community organizations, what are the situations now? Are they monitoring, or are we going to have to um, give raise awareness about this? So there isn't that. So that's why we're here. We're in this struggle. We're fighting to try to find the way to inform the community. We're doing live through social media. We also have our community radio, and we invite all of you to give this information. We're doing this in different indigenous languages and other indigenous languages that are here in the region. It's very complicated that we see, especially when we speak to people. People mention, well, I'm undocumented. I have impacts here. There are these things happening in other areas. Here in Ventura, we have resources with this pandemic. If a person comes out positive and you work in the fields, you can work with that organization so that they pay for like a hotel, so you are able to self quarantine and keep your family safe. And that also provides additional resources. But that program is only here in Ventura. Many counties ask us here in Ventura, well, how is this happening? Well, for example, people here in Oxnard, many people go from here and move up to Salinas, and then they mention, but these programs are not in Salinas. How can we access these programs? And we have to say, well, unfortunately, these are the resources that we only have here in Ventura because of our work of going through
Son varios
marches, of writing
organizaciones que
into
tenemos
the
y estoy muy de acuerdo con Oralia
this by
que son
many
los problemas
different
que existen y
organizations in the
yo sé
region.
que existen esos
So I'm
problemas
very in
porque
an
yo fui
agreement with
un trabajador del
Oralia.
campo, ahorita estoy haciendo trabajo
We
de
know these
comunitario.
problems exist because as a community organizer, I know these things as well as being a farm worker myself previously. So I understand all of these things of reprisal of low wages, and then added to that, the pandemic.
Pues muchas gracias, Jorge, por sus comentarios. Sí, estamos muy de acuerdo, creo. Y,
Thank you, Jorge, for all of your comments. We're very in agreement, and perhaps we can continue in this conversation after this reunion, and we should speak about that a bit more. One of the things that switch to English.
One thing that comes to mind from what you just said and how complicated all of these layered problems are. I mean, there's so many needs here and so many needs for solutions and reinventing systems that are, provide people basic dignity in doing this important work. But one thing that comes to mind is that we know that in this moment where all of the systems failed farm workers in specific response to the pandemic, that community-based organizations like MyCop, like CBDIO, like Líderes Campesinas, filled in the gaps of what the places where the state has failed as best they could, right? In terms of, you had a big state program trying to distribute masks eventually, too slowly, but trying to get masks out to farm workers. But they did it in a really a really poor way. You know, they gave them to agricultural commissioners, they gave them to county health departments that don't have farm worker networks. And so again, community-based organizations stepped in to fill that gaps, and that was not a perfect system, right? And so I think that like the way that we did this study by putting community-based organizations at the heart and understanding that, you know, farm workers are not hard to reach populations for our community partners. They're their friends and their neighbors and their family members and themselves. That there has to be a real partnership built that invests in, the state invests in these community-based organizations with trusted networks, and that there's a lot of work to do to make sure that any kind of support that is, you know, coming from the state out comes through networks like the ones that CBDIO has and MyCup has, and not one nonprofit trying to reach the whole state. That's easier for the state to partner with maybe, but doesn't actually do the networked work of reaching farm workers. So yeah, that's one possible place where, you know, building trust, investing in community-based organizations, and having a real dialogue between the state or county governments and those organizations would maybe put us in a better place to be able to provide support to farm workers. Oralia, I'm sure you have lots of thoughts about that too. ¿Qué piensa?
Esto lo que comenté es nomás a los trabajadores.
So what I
locales.
mentioned is only to local workers who are here, but also for H2 workers. I remember very well that in 2018, 2019, where we had all of these fires in Oxnard, in Santa Paula, we went to the fields to give masks, N97, so that the smoke wouldn't pass through and affect people's lungs. So what we see that in the companies, they had a resolution that the companies must give masks to their workers. And we went to monitor all of these areas, and we found that H2 workers did not have these masks. These are the H2 workers that are temporary workers from Mexico or the South coming to work temporarily. So many of the workers were a bit fearful to come and speak to us. We had to mention that the services and information and resources we were giving, like the masks, were free, but they were responding, well, we might have a reprisal from the bosses. And we know that there's people that have been infected by COVID-19, at least 100 people that were infected, and they are H2 workers. So like Aurelia was mentioning, there isn't a control. They live in a small room with 4 or 5 people, and the law says that they must have adequate housing and nutrition. But however, many of the workers work 2, 3 people in a small room. The food is precarious, and sometimes they just get a sandwich or some chips. And this is something that we're seeing here. So we have received calls that they haven't paid what they promised us. And again, the fear encroaches that they might be reported on, that they might get reprisal for speaking with these agencies. We tell them we could give phone numbers or information just so that they also receive information. But again, there's this fear of reprisal from the owners. So this is that frustration that we feel that we couldn't do more because the laws also don't permit us to do these things as well. Thank you, Jorge. And also there are many situations, many things that farm workers are living, and we know that time is limited. and now is to speak about the circumstance now with COVID, but it is also many things that is happening with workers in the fields, but is to continue into the future and to do the work in our effort as organizations to assure that the people in our communities have the benefits to that they deserve and that they are informed and also how to um, self self advocate. Yes, there are a lot of challenges that we need to attend to. And one of these is the collaboration, the lack of collaboration with the Department of Agriculture, with community organizations, and then the political will of our representatives to make these changes. So it's worth to keep working.
Los supervisores nos dicen cuando vamos a los campos, nos dicen, ¿sabes qué? Deja todo el material que tienes aquí, dáselo al supervisor.
So these big ranchers tell us when we give PPE material, they tell us give this material just to the supervisor will give all of this material, but what we say is no, we are going to stay. So when we see the workers themselves, we can give them this material to them directly because the workers don't trust the bosses. So this material of distribution, there are obstacles. However, we've been able to succeed and we will continue to promote and impose this in many of the places where we can do it. Thank you.
Por esta oportunidad. Creo que ahorita ya rebasamos del tiempo que nos habían programado.
So perhaps we're going beyond the time. So thank you, Ildi and Margaret. We're going to continue to work so that we continue to work with our communities so that we assure that many of the people here can do what is corresponding of everybody so we could all achieve this justice. So that
I think that's Oralia took us out. That was good. Thank you everyone for the chance to speak and what a wonderful conversation. I'm gonna put my email in the chat and you can reach out to me. Y tal vez Oralia quieres poner la tuya también en el chat email para que seguimos esta conversación en el futuro.
So we continue this conversation into the future. There's many things to talk about.
Start of a conversation and a coalition of folks that continues to think about these issues together and keeps pushing for the big changes we need.
Thank you so much, Oralia, Carmen, and Ildi. And I was thinking I could continue to collect lingering questions folks have and see if we can weigh in on them and send them out in a follow-up email after the session. And we'll also send a recording of the session for anyone who wasn't able to make it for the live sessions. So thank you all for staying a little bit longer. We want to respect everyone's time, so we'll log off now, but thank you all so much.
Thank you.
Wonderful to hear from you, and yeah, take care.